Thank you very much, Mr. Speaker. And Mr. Speaker, I rise to make a statement on the fight back against coronavirus. Across the country, our vaccine rollout continues at pace. With each vaccine we administer, we're one step closer to normal. As of today, we've vaccinated 9.2 million people. And I want to thank everyone involved in this collective national effort that saw nearly 1 million people get vaccinated last weekend alone. Or put it another way, 1 in 60 of all of the adults in the UK. We've now protected almost 9 out of every 10 people over 80 and half of people in their 70s. And I'm delighted that we've been able to visit every eligible care home, 10,307 in total. I want to thank everyone involved in that effort, including, of course, the NHS, our dedicated staff in social care, the residents themselves too for coming forward. And I want to pay tribute to my honourable friend, the Minister of State for Care, who's worked so hard to help us meet this ambitious target. I know that many of us in this House are playing our part in the national vaccination effort. And today we've published a new resource for the House that provides more information on the vaccine rollout and how all colleagues can play such an important part in increasing the take-up of the vaccine in their area. Because the take-up of this vaccine will directly impact how effective the vaccines are and how fast we can safely get out of this. Mr. Speaker, we're confident we have the supplies to meet our target to offer the vaccine to the 4 most vulnerable groups by the 15th of February. We now have over 400 million doses of vaccine on order, including the additional 40 million doses from Valneva that we ordered yesterday. And Mr. Speaker, that we find ourselves in this position is no accident. Our strategy has been to invest early and invest at risk. We've backed many horses, no matter where they're from, and we've also built up our vaccine manufacturing capability here at home. As a result, today, we have the AstraZeneca jab being manufactured in Oxford and Staffordshire and Wrexham, the Novavax vaccine made in Teesside, and the Valneva vaccine manufactured in Livingston in Scotland. It's a great example of what we can achieve together working as one united kingdom. Mr. Speaker, despite this optimistic backdrop, we must continue to act with caution, not least because of the renewed challenges posed by new variants of the coronavirus. We have found here 105 cases of the variant first identified in South Africa, including 11 cases which don't appear to have any links to international travel. As with the variant first identified here in the UK, there's currently no evidence to suggest it is any more severe, but we have to come down on it hard. Our mission must be to stop its spread altogether and break those chains of transmission. In those areas where this variant has been found, parts of Broxbourne, London, Maidstone, Southport, Walsall and Woking, we're putting in extra testing and sequencing every positive test. Working with local authorities, we're going door to door to test everyone in those areas, and mobile testing units will be deployed, offering PCR tests to people who have to leave their home for work or other essential reasons. We have also seen 11 cases of mutations of concern in Bristol and 32 in Liverpool, and are taking the same approach. In all these areas, it is imperative that people must stay at home and only leave home where it is absolutely essential. When your local authority offers you a test, you should take up the offer, because we know that around 1 in 3 people with coronavirus have no symptoms but can still pass it on. We're offering testing to everyone aged 16 and over, even if you have been vaccinated. And if you live in one of those areas but have not been contacted and you're unsure if you should have a test, I encourage you to visit your local authority website to find out. Anyone who must leave home to go to a workplace, for instance, because they cannot work from home, should get tested. All local employers should support and encourage their workers to get tested, and the message is more important than ever: to stay at home, maintain social distancing, and get tested. Mr. Speaker, across the whole country, we're expanding workplace testing, including here in Parliament itself. And this morning, you and I together visited the new COVID testing site here in Parliament, which offers all of those who work here, peers, MPs and staff, the chance to get tested. I took a test this morning, thankfully negative. It's quick and easy, and you get the result back fast. And I encourage colleagues who have to be here in person to sign up and do the same. And for all of us, no matter where we live, we need to continue to follow those rules, because while more scientific work is underway to learn more about new variants, we know with absolute certainty that social distancing works. It denies the virus the social contact it needs to spread. We must all keep at it. We've sacrificed too much and come so far with the vaccine to give it up now. And I know that we won't. Mr. Speaker, in closing, if I may say, while we've been working night and day to fight coronavirus, I have often drawn inspiration from our fight against another killer pandemic of HIV, a disease that also took too many people before their time. And this is HIV Test Week. It's a reminder of how important it is to get your free HIV test. But it's also a reminder of the progress we've made in tackling that terrible pandemic, that we can credibly commit to no new transmissions by the end of this decade. And today, I'm sure the whole House will join me in wishing Lord Norman Fowler a very happy 83rd birthday. He was an inspirational former Health Secretary, a fearless advocate for tackling HIV and AIDS. Lord Fowler is someone who knows the importance of taking action early and the power of testing to turn the tide. So as we face these difficult weeks ahead, we can all draw inspiration from that great struggle, that even when faced with a mountain of challenges, science, ingenuity, and the sheer power of will can see us to better days ahead. And I commend this statement to the House.
Shadow Secretary of State, Jonathan Ashworth.
Well, Mr. Speaker, and grateful as always to the Secretary of State for advance sight of his statement. And can I thank you, Mr. Speaker, for putting in place the arrangements for testing on the estate. I'm sure members and crucially staff on the estate are extremely grateful for that initiative. Now, and I also extend my best wishes to the Lord Speaker as well on his birthday today. Now, the news that the South African variant has been identified in 8 different local authority areas is alarming and suggests significant community transmission. Can I just ask him to run through the timelines? Because when did these 11 cases test positive? And how long does the genetic sequencing take? And when was he told of these cases? And can these processes be made speedier? I'm told, for example, the Ealing case tested positive in late December. Now, these variants bring into focus the importance of border controls. Times Radio reports that hotel quarantine arrangements won't be in place until the 15th of February. Why the delay? And according to the Times newspaper, Sage warned 2 weeks ago tougher quarantine restrictions for everyone entering the UK were needed. The government disputes this interpretation, so will he publish the Sage minutes from 21st of January? I welcome the extra testing, but can I suggest he goes further? Because people move beyond their postcode boundaries. They go shopping. Many still have to go to work. Will he therefore roll out testing in neighbouring postcodes? He wants to come down hard on this variant, but isn't the lesson of mass testing, such as in Liverpool, that people are hesitant to take a test if they aren't compensated for any loss of income associated with self-isolation? We are fighting this virus with one hand tied behind our back, asking the low pay to go hungry in order not to spread the virus. Transmission chains won't be broken without decent sick pay and isolation support. We've seen the Kent B777 variant spread with speed. Now, Public Health England's latest technical briefing reports that the B117 sequences with the E484K mutation seen in the South African variant, and this has now been identified. This is very worrying because it's this mutation which is thought to be behind the partial vaccine evasion. Surely this suggests that further action is going to be needed. So, for example, Germany, Austria and France are recommending FFP2 face masks on public transport and shops. I mean, the chair of the Select Committee has also suggested this. Will he now review the evidence and look at this? And on vaccination, I again congratulate the NHS. Now, not all care homes have been vaccinated. Those with a COVID outbreak have not been vaccinated for understandable reasons. But could he tell us how many of these care homes are outstanding? And there have been reports of some care staff turning down vaccination. So can you tell us how many care staff have been vaccinated? And will he ensure the NHS collects data on the numbers turning down vaccination so we can target and overcome vaccine hesitancy more effectively? Public health services have an important role in tackling vaccine hesitancy. When will public health directors know their allocations for the next financial year? And Mr. Speaker, UNICEF have warned that children are not the face of this pandemic, but they risk being amongst its biggest victims. Now, I accept it was inevitable that schools would close given community transmission levels, but that doesn't make it any less devastating. We're depriving young people of social interaction, of play with their friends. Learning is not the same. Mental health problems are increasing. There'll be children in homes where there is violence or drink abuse or substance misuse prevalent. Children's health must always be a priority. So on current plans, how many teachers will be vaccinated as part of bands 5 to 9? And how many teachers and support staff will have to wait until the period between Easter and summer to be vaccinated? Last September, it was reported 25,000 teachers had been off sick related to COVID, further disrupting children's learning. So how can he ensure we don't see the same disruption again from March when it's hoped schools return? Finally, Mr. Speaker, this is indeed HIV testing week. And over the weekend, I binge-watched It's a Sin. And I was in tears. Mr. Speaker. Now, thankfully, HIV is not a death sentence today. People living with HIV are in phase 6 for vaccination, but only if they have disclosed their HIV status to their GP. Many haven't and still don't want to because of the stigma we saw portrayed in It's a Sin. So will he ensure that people living with HIV are able to access vaccination at their HIV clinic?
Secretary of State.
Thank you very much, Mr. Speaker. And just to answer the honourable gentleman's many questions, he's absolutely right to raise the importance of of coming down hard on the cases of new variants that we've discovered here in the UK. And these are cases that have been seen over the past 2 months. And the action that we're putting into place is action to make sure that we stop further spread and further spread in the community, alongside the action taken to ensure that there's no spread from those who have got a history of international travel. As he knows, we brought in tougher action at the border, and we stand ready to do more. He asked for the SAGE minutes to be published. They are published regularly. And he also asked for the neighbouring postcodes to those postcodes where a new variant case has been found, where it's a new variant that is a variant of concern. We absolutely do that where it is epidemiologically sensible. So, for instance, if the case is found on the border of a postcode, obviously we go across that border. And we also investigate linked premises. For instance, if somebody had a child at a school or is going to work in a particular workplace, and then working with the Director of Public Health, we will ensure that testing is directed there as well. He raises the issue of isolation payments, and we have the £500 isolation payment in place. So nobody need, as he put it, and nobody should go hungry because they have to isolate. What is critical in these areas is that people stay at home unless they absolutely have to. It is imperative that people follow the rules to get these new variants completely under control. He asks on the care home success. I'm delighted that we've been able to reach so many care homes. I said in my statement that we have reached 10,307 care homes. That's in England. There are 110 care homes where the vaccination programme is still outstanding because they've had outbreaks, and for clinical reasons, the vaccination programme can't start there, but it will as soon as it's clinically possible. He also asked about the data being shared from the vaccination programme. That data is now routinely shared with local directors of public health, precisely for the reasons that he sets out, so we can reach more parts. And finally, he ends on the question of education. And of course, we understand how challenging the impact of this lockdown is on those with with children who have to be schooled at home. And that's why the Prime Minister has said that schools should be the first thing to open when it is safe and possible to do so. Sadly, that time isn't yet, but the more that we all follow the rules that we've set out so clearly, the quicker that time will come.
Video link to the Chair of the Health Select Committee, Jeremy Hunt.
Thank you, Madam Deputy Speaker. And can I thank the Health Secretary for liaising with me on the issues in Surrey over the weekend, where the actions taken by him and the outstanding leader of Surrey County Council, Tim Oliver, are absolutely right. He mentioned that at the weekend, we reached the milestone of offering the vaccine to everyone in care homes, except for where there's been an outbreak. Does he agree that we should crown that tremendous achievement by making 2021 a year as significant for the social care sector as 1948 was for the NHS when it was founded, with a long-term financial settlement, implementing DIL not, and setting it up for the future with a 10-year plan?
Well, Madam Deputy Speaker, my right honourable friend knows that we set out in our manifesto, committed in the manifesto, and were elected on a manifesto to resolve the long-standing problems in social care. The Prime Minister has set out to the liaison committee, of which he, of course, is a member, the timetable on which he hopes that we're able to deliver on that commitment. Alongside dealing with this pandemic, Madam Deputy Speaker, we are working to deliver our manifesto commitments, whether it's on social care or the 40 new hospitals or the 50,000 more nurses. And I look forward to being held to account by the Select Committee on those commitments.
Video link to the SNP spokesperson, Dr. Philippa Whitford.
Thank you very much, Madam Deputy Speaker. I would like to associate myself with the Secretary of State's comments on HIV Test Week. But it's very concerning to hear that over 100 cases of the South African variant have been detected in the UK, particularly as they don't represent a single outbreak, but are widely scattered across England. The concern, of course, is that while current vaccines will still give a significant degree of protection, this variant's resistance to some COVID antibodies could reduce their effectiveness. So does the Secretary of State plan to tighten internal travel restrictions to avoid it spreading across the UK, as happened with the Kent variant? And will there be increased random genomic testing of PCR specimens out with these areas to identify just how widespread it already is? Unfortunately, this is shutting the barn door after the horse has bolted. The government has been aware of the concern about this variant for some time, and the SAGE advisory group warned that limited travel bans wouldn't be enough to keep out new COVID variants, and the only way to stop them would be mandatory quarantine for all arrivals. So why did the government choose not to follow this advice? This variant is already present in many countries, and new, more resistant COVID variants could evolve anywhere in the world. So will the government now reconsider their very minimal quarantine plan and extend it to all incoming travellers? And finally, as new strains brought in through holiday travel last year contributed to the second wave of COVID, is the Prime Minister seriously suggesting people should go abroad on holiday this summer?
Well, thank you very much, Madam Deputy Speaker. I think what the SNP spokeswoman failed to mention is that it's only because we built the huge genomic surveillance capacity that we now have that is available right across the UK that we've been able to spot these variants of concern. And this is a critical point because these sorts of variations happen everywhere, but the challenge is to spot them as soon as you can and act on them. She asks about travel, and we've already in place rules against all non-essential travel with a clear stay local guidance. And we also have mandatory isolation for new arrivals. So yes, we have tightened in response to the new evidence that she mentions. But she didn't also mention the fact that it is only because the vaccine program is rolling out so rapidly across the whole UK that we are able to protect people against the old variant, which of course is the most widespread, the combination of the old variant and the variant first discovered in Kent. And that is the way that we will get out of this, this situation. That is a UK programme, and we are enthusiastic and willing, from the UK government point of view, to do everything we possibly can to support that rollout, including all the way across Scotland, to make sure that people in Scotland and every other part of this United Kingdom can get their jab as soon as possible.
Video link Robert Halfon.
Thank you, Madam Deputy Speaker. I pay tribute to my right honourable friend and the Vaccinations Minister for the work that you have all done on vaccines. Will my right honourable friend thank Essex Council, NHS staff and volunteers in Harlow who have so far vaccinated many thousands of residents. Public Health England have said that adults over 18 with learning disabilities are at greater risk of dying than most people aged 65 to 74. International studies show that if you are learning disabled aged 55 to 64, death rates are comparable with those over 80. My right honourable friend will have seen the parliamentary petition on this signed by many thousands. So will he work with the JCVI to move the adult learning disabled high up the priority list for vaccinations?
Could you state?
Well, thank you, Madam Deputy Speaker. I pay tribute to all those who are working in Harlow, including at the Harlow mass vaccination site, and also the GPs and the pharmacists who are working so hard to vaccinate people right across Harlow. On the question of the JCVI ordering and the prioritisation for vaccination, as he knows, I think the best approach is to take the clinical advice and to follow that clinical advice. The sorts of considerations that he raises are an important part of the JCVI deliberations. I know they've looked very closely at the subject that he raises. What matters now that they've made and published their decision, is that we drive through the vaccination programme to get through as many of those groups as possible. I'm very pleased to see the hundreds of thousands of new vaccinations that are taking place every day.
Video link Dame Angela Eagle.
Thank you, Madam Deputy Speaker. Sage warned about the dangers of the South Africa strain weeks ago, but the Prime Minister dragged his feet, and he's now decided on a partial quarantine arrangement that Sage has already warned will be ineffective in preventing further introduction of this variant. So isn't it the case that once again the government have acted too little and too late to stop the spread of this new and dangerous variation in the UK?
No, on the contrary, we removed the travel corridors to ensure that there is a self-isolation requirement that is mandatory for all those who are coming to this country, and protecting this country from new variants coming from abroad is important. Hence, we've taken the action swiftly, and we did that on the basis of the scientific evidence.
Philip Hollowbone.
Could I commend the Health Secretary for the difficult, brave, but correct decisions he made early on in the pandemic in relation to vaccines, which has led today to Britain having a world-leading vaccine rollout. And could I also draw his attention to NHS Northamptonshire, which, thanks to the very hard work of all the local staff and volunteers, has one of the very best vaccine rollout programmes in the whole country.
Yeah. Yes, I've been watching the progress of NHS Northamptonshire, who are going great guns, and I know they're working incredibly hard. This doesn't happen by magic, it happens by hard graft, and especially the GPs and the pharmacists and the support teams and the volunteers who are doing such a great job in Northants. And I'm very grateful, Madam Deputy Speaker, to what my honourable friend said. We did take decisions at risk early, before we knew whether they were going to come off, knowing that we'd be criticised if it didn't work out. But that meant that we could get those contracts signed ahead of many other places, and it means that we will be able to deliver vaccines for UK citizens, and then, of course, play our part ensuring that everybody across the world can have access to this life-saving vaccine too.
Video link, Zara Sultana.
Thank you, Madam Deputy Speaker. The government's catastrophic mishandling of the virus has meant that in the past month, there were over 32,000 COVID deaths in the UK, an average of more than 1,000 a day. In New Zealand, there was 0. In Vietnam, 0. Australia, 0. In Taiwan, there was 1. The difference, these countries pursued a zero COVID strategy, suppressing cases, saving lives, and reopening economies. The vaccine offers hope, but so long as the virus circulates, there is a risk of thousands of more deaths and now more dangerous new variants. So does the Secretary of State regret his government's decision not to pursue a zero COVID strategy, and will he now commit to this strategy?
All countries that have attempted a zero COVID strategy have found that this virus transmits and it gets round the boundaries that have been put in place. There were parts of this country that tried a strategy of zero, and in fact we were urged to do so in this House. But what matters is making sure that you get the tools that are going to be used permanently for us to get through this, and we get them deployed as fast as possible. And that means testing with the hundreds of testing sites that are now available, and crucially, it means getting this vaccine rollout. She said the vaccine offers hope, and I think that is where we should all focus on getting this vaccine rolled out as quickly as we possibly can.
Rob Roberts.
Thank you, Madam Deputy Speaker. The Betsy Cadwallader University Health Board in North Wales has had some difficulties over a number of years, and it wasn't surprising, therefore, that there was a collective sharp intake of breath and mutterings of "here we go again" when the vaccine got out to a little bit of a faltering start in North Wales. My colleagues from these benches and I have been in constant contact with the Health Board, and are pleased to report that now things are back on track. They're making really good progress, and they're very, very confident of being able to hit that target of the first 4 groups by the middle of February. My right honourable friend, therefore, join with me in paying tribute not only to the staff of the Health Board, but also the legions of volunteers, the Army forces, and all of the people who are involved in that, who are doing such a fantastic job in North Wales.
Will, it's close to my heart, Madam Deputy Speaker, and I think that right across this UK, people have done extraordinary things and worked incredibly hard to deliver this vaccine rollout, and we've been working as hard as we possibly can as a united kingdom to support the NHS in Wales, in North Wales, my honourable friend, in Scotland, in Northern Ireland, to make sure that this vaccine is delivered as safely and as rapidly as possible to all parts of these islands.
Dan Carden.
Thank you, Madam Deputy Speaker. And it's wonderful to see so many people being vaccinated so quickly. And it shows the value of investing in the right people, in the right place, at the right time, and using our National Health Service, GPs, and local public health professionals. But the vaccination isn't the end of the story. Social distancing will continue to play its part. So will test, trace, isolate, and support. And of course, new variants threaten to take us back to square one. So can I ask the Secretary of State to learn from the obvious lessons from this government's failures and successes, put local health teams in charge of test and trace with the proper funding that they need, but also fix the broken system of support, the £500 payments and those not entitled to statutory sick pay as quickly as possible.
Well, Madam Deputy Speaker, I take all that as a compliment. The £500 payment is incredibly important for supporting people on low incomes. The huge rollout of test and trace, the fact that now over 90% of contacts are identified and contacted by NHS Test and Trace, who are doing a magnificent job, and of course the rollout of the vaccine, which is going so rapidly. The fact that this weekend, 1 in 60 of all of the adults in the country got a jab, I think is a testament to that. So we absolutely always are looking to improve and to learn lessons wherever we possibly can. But I'm really glad that things are making the progress that they are.
Steve Brown.
The Secretary of State said about HIV, and binge watching It's a Sin is 5 hours well spent, and a reminder of how close we are to that magic zero transmission. And the government's acceptance last week that the release of our society, rightly starting with our schools, should move in lockstep with the success of vaccine rollout was really welcome. Can the Secretary of State assure parents that we will follow an increasing number of countries around Europe and indeed in the UK and stick to that as the vulnerable groups and those liable to overwhelm the NHS are protected?
Yes, of course.
Video link, Munira Wilson.
Deputy Speaker, with the Prince's Trust reporting a record high of more than half of young people often feeling anxious, and some A&Es reporting daily daily seeing children coming in with self-harming and overdosing, it's clear that the pandemic is taking an enormous toll on children and young people's mental health and well-being due to school closures, family pressures, social isolation and bereavement. So will the Secretary of State commit today in Children's Mental Health Week to urgently forming a cross-departmental plan for tackling the impact of the pandemic on children and young people's mental health?
Well, Madam Deputy Speaker, we have put a significant amount of extra funding into supporting children's mental health alongside adult mental health, as we know that one of the consequences of the lockdown, which is absolutely necessary, is that it does put significant pressure, and we have seen the increased burden on mental health services, and it's very important that people get the support they need.
Mark Harper.
Very much, Madam Deputy Speaker. Can I just add my congratulations to those that have been rolling out our vaccine? I listened carefully to what my colleague from Northamptonshire said, but can I just put on record my thanks to those in Gloucestershire, which as of last Thursday was the top performing part of the country, and Hereford and Worcestershire next door was the second highest performing, which kind of makes them the highest performing rollout in the whole of the Western world. So can I thank the Secretary of State for his help and that fantastic performance. Can I just take him back to his answer to my honourable friend, the member for Winchester? The whole point of this vaccine rollout is to make sure that we protect the vulnerable, reduce the death toll, and reduce hospitalisations and the pressure on the health service. Given the vaccine rollout's going so well and ahead of where I suspect the Secretary of State thought it would, can I ask him to confirm that on March the 8th, when we start seeing schools going back, that it'll be those two metrics, deaths and hospitalisations, as they fall, which will guide the reopening, not just of schools, but of the rest of the economy?
Thank you very much, Madam Deputy Speaker. Well, the Prime Minister has set out 4 metrics that we will follow. Deaths and hospitalisations are 2 of them, and they are both incredibly important. We expect deaths to fall faster than hospitalisations because because older people who are higher up in the right cohorts by the JCVI are more likely to die by a greater degree than they're more likely to use hospital beds. And then the other 2 considerations are that we don't see further new variants that put all this at risk, and of course that the vaccination programme rolls out well. I wouldn't say that the vaccination programme is ahead of plans. I would say that it is on track. I make no further claim than that.
Jim Shannon.
I thank the Secretary of State for his and his department's wisdom and forethought for securing the vaccine for all of the United Kingdom and Great Britain and Northern Ireland. Better together. Always say that, but it's the truth. As some members will remember, the last smallpox outbreak in the UK was in the 1970s and was combated by health workers going door-to-door testing. I understand the rationale behind this decision, but can I ask the Secretary of State, what discussions have been had with the Treasury to secure additional financial support to enable each devolved administration to carry out similar schemes if the need arises in every part of the United Kingdom of Great Britain and Northern Ireland?
Yes, thus far we of course stand ready to put in place financial support for the devolved nations should that be needed in order to tackle outbreaks like this. We have a constant conversation with the devolved authorities, and I speak, for instance, to Robin Swan, the health minister in Northern Ireland, on a regular basis. I was talking to him on Saturday morning about supply of vaccines, as the honourable gentleman might imagine. So it is something we work very closely together on. But the fundamental point that he makes, Madam Deputy Speaker, is absolutely right, that it is by working together as one United Kingdom that we're managing to do this on vaccines. And if you want a shining example of why this country performs so well when we work together, just look to the vaccines programme being rolled out in every corner of the country, in every locality, with all nations working together in a single combined mission. It is a celebrated example of why this country works well when we're better together.
Sir Graham Brady.
Thank you very much, Madam Deputy Speaker. Can I thank my right honourable friend for repeating his commitment to ensuring that schools can get back as soon as it is safe to do so. But as he reflects on that, can I ask him to keep in his mind the very sobering words of Professor Russell Viner, the President of the Royal College of Paediatricians, who said to the Education Select Committee, when we close schools, we close children's lives, and then went on to refer to 75 international studies which suggest significant mental health damage for children. And will he reiterate the huge importance that there is in putting children's mental health and well-being alongside the other onerous responsibilities that he bears?
Secretary of State.
Yes, I agree entirely with my right honourable friend. The Royal College of Psychiatry have been very clear in describing the negative impact of school closures and also the negative impact of the virus getting out of control. The challenge we have is to try to mitigate both of those problems, and it is the vaccine that is the best way through.
Video link, Ruth Jones.